Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant, Obstetrics and Gynecology at Cloudnine Hospital, Lucknow Division. So what is placenta previa? A placenta, we all know, is the organ which supplies blood, nutrients to the baby. Placenta previa is a condition where there is an abnormal location of the placenta, normally this placenta being low down in the uterine cavity. In any normal pregnancy, a placenta should not be low-lying, but however, when we see one which is low-lying on an ultrasound, we label this mother as a placenta previa mom. There are certain types of placenta previa. There is one which absolutely covers the mouth of the uterus, which is called the cervix. It's called a complete placenta previa. And then we have something called a low-lying placenta previa. A low-lying one can be one which is within 2 centimeters of this opening of the uterine mouth called the cervical internal os, or it can be slightly covering, which is a partial type. However, we refrain from using these old terminologies. We stick to using low-lying and a complete. In a mother who has been diagnosed with placenta previa early in her pregnancy, reassurance is must, as most of the time we'll be able to see that the placenta has migrated up in our follow-up scans, and that will be around 32 weeks. We get to know the final location of the placenta. The position, however, never changes. If your placenta has implanted posteriorly, it will remain posterior. If it has implanted anteriorly, it will remain anterior, that is in front in the uterine wall. It never swaps its position. It can change its location from low-lying to a high-lying. Now, such a mom who comes to us with a low-lying placenta, we definitely are going to tell them to avoid air travel, to avoid long-distance travel. No, intercourse is an absolute no. No forward bending, no heavy weight lifting. A mom who's had spotting, that is slight blood spots seen on her panty or on her bed sheets, at the time when she's been diagnosed with the placenta previa, must be admitted. If she's already 28 weeks plus, she'll be admitted, given steroids, given the necessary medication to stop the bleeding, will be kept under strict surveillance for a few days till bleeding stops. Patient can be always reassured, sent back home with an assurance that she will refrain from doing all the precautions that I have described before, all the activities that's described. Such a mother has to be absolutely careful that she is never left alone at home, as there can always be a painless bout of bleeding, and that is the time such a mom needs to be rushed to the hospital. And most of the time when there is bleeding above 32 to 34 weeks of gestation, an emergency delivery is indicated in the form of a cesarean section, which remains the safest form. What we also need to take care at the time of delivery is that her hemoglobin levels are adequate. In case she's slightly anemic, moderately anemic, it's a good option to always arrange blood for such a mom. A placenta previa mom should always be in touch with her obstetrician, have all her emergency numbers in store, and must always follow up regularly with her obstetrician for extra bit of care. Thank you.